we're very pleased that we've got today's workshop on critical political economy of health movements, which is looking at a paper. First of all, we're starting off with a paper co-authored by Mònica, Clua-Losada and Olatz, Ribera-Almandoz, Health Movements in the Age of Austerity, Rescaling Resistance in Spain and the United Kingdom. And we're very pleased that Mary Naughton will be able to give us some comments on the themes that arise from the paper and related themes as well, because her work also focuses on similar kind of areas. So just to introduce, Mònica Clua-Losada is professor at the Department of Political Science at the University of Texas, Rio Grande Valley. Her research focuses on the critical political economy, critical political economy and the role of subaltern groups, with a focus on labour in the context of authoritarian neoliberalism, as well as being a earlier convener of the CPERN board and currently co-editor-in-chief of the new journal, Global Political Economy. Olatz Ribera-Almandoz is an associate researcher at CDOP, which is the Barcelona Centre for International Affairs, in the area of migration. She's also a member of the Johns Hopkins University at UPF in Barcelona Public Policy Centre. Her research focuses on the interactions between social agents and public institutions in the context of multi-level states, with a special focus on migration and asylum policies and the new demands of social justice, welfare and housing. And she recently completed a PhD in political and social sciences at UPF in Barcelona. And finally, Mary Naughton is based at UCD in Dublin, where she works doing on her PhD studies as part of the ERC project, Labour Politics and the EU's new economic governance regime. And she recently published a piece, Mobilising Societal Power, Understanding Public Support for Nursing Strikes in the Industrial Relations Journal, which I think we're pleased to see because it's one of the first papers that was heard at one of our first early career scholar writing workshops, the second of which is taking place in Limerick in July. So we were pleased that to see a paper coming out that had some interaction with our writing workshop. So congrats to you, Mary, on that paper. Thanks to you all for agreeing to speak. I'll hand over now. I'm very pleased to see this. I'm really interested in the question of how does scale interact with processes of resistance and austerity and resisting austerity. So thanks. I think Mònica, you'll go first. We're going to go for 10 minutes for each speaker, and then we'll open it up for a discussion. So thank you.
Thanks. I'll probably won't use all 10 minutes because with Olatz, we kind of calculated 10-15 minutes for both of us. So we might not take the entire time, which would be good because part of what we want to do with this as well is to kind of have a discussion, not just about the context of the paper, which is the post-2008 and particularly the 2012 kind of austerity cuts in healthcare systems, both in Spain and the UK, but also kind of look at how that translates in the pandemic and post-pandemic time in relation to healthcare systems and particularly resistance to those cuts. But before I start, I actually wanted to basically just kind of have a moment of thought or silence or of speaking, I'm not sure what, but to send solidarity to our comrade, our two comrades, Yulia Yurchenko and Alyona Niasheva, who are both CPERN members and are currently in the Ukraine and actually escaping the places where they were and have spent the entire day escaping to possible safety, but perhaps not, it's unclear to know. But primarily, two of our loved comrades whose lives have just been turned upside down by yet another imperialist war. And so I think it's important that we are aware that we're not holding this workshop in any kind of normal circumstances, but in rather exceptional circumstances and where our own people and their lives are at risk. So I apologize. And I apologize because my headspace today is not quite with this. And so I do apologize if at some point I don't make much sense, but I've been quite worried, like many of us, I think, have been all day. But going back to the article, the article very much, and I have to say that probably and just to reiterate, Olatz is the first author because Olatz actually carried out the field work, and this article comes out of Olatz's PhD thesis. It was one of the chapters, one of the articles in the PhD that I had the honor and pleasure of supervising. And so it's something that, it has a lot of work, as we all know. Articles based on PhD thesis actually have a lot more work behind them than normal articles, because there's a much larger engagement and time spent. And so I think it's worth also seeing quite a lot of that. The article, in a sense, situates health movements, and that is something that we were very kind of interested in developing, because whilst there has been a lot of research on social movements and social movements against austerity, there has never been that much on the concept of what we called health movements, even though it's a concept that had been also used before, but basically social movements around the defense of a public good such as healthcare. And so it focuses very much on those processes of commodification and privatization in both Spain and the United Kingdom, two places where they're not only interesting because they both have universal free at the point of care, healthcare systems, and that are pretty much kind of establish and hold, we could say, large public opinion support for those across ideological lines. But it's also even more interesting because actually the processes of privatization in both countries and commodification have also been quite deeply entangled in a sense. So one of the situations that we look at and that we mention in the article is the creation of foundation hospitals by the NHS. And so those are hospitals where very much there's a very direct introduction of the profit motive in the running of those hospitals, and that was actually something that as we kind of searched and trolled through press clippings and other issues, was very much done in conjunction at similar times and in collaboration with the similar process that was going on in Spain. So there was within those kind of policymakers engaging in commodification and privatization, there was a hell of a lot of what our non-so-critical colleagues might call it policy learning. So the collaboration was very much there at that level as well. But also, we thought that healthcare was a very interesting case to look at the issue of rescaling, because especially, again, in both systems, there is a very large element of decentralization of healthcare systems. And the way in which that decentralization has occurred in both countries has also often been a kind of a very messy situation of, on the one hand, appearing to provide more power to the local level, or more power in the case of Spain to the autonomous communities, but it has also been very often utilized as a way of furthering privatization and commodification of services, as we've seen with kind of NHS, healthcare trusts, etc. So there is quite a lot of that. And I will let kind of Olatz really give us a lot of the detail of the cases, because I think she's the one that's much closer to those, and she's the one that kind of did the research on those. But I think what I would like perhaps is to just kind of direct you, I guess, towards what I think would be a very interesting discussion afterwards, which is kind of looking at what our paper perhaps can help us understand of future strikes, like for example the strikes that Mary researches in healthcare, but also in the context of extremely damaged healthcare systems that we have at the moment after a decade, if not more, of privatization and commodification, and now 2 years of pandemic conditions. And so how all of that is going to perhaps put healthcare as at a really kind of point of struggle, or something that we might have to continue struggling for. So I'll give the word to Olatz. Thank you.
Thanks, Mònica, and thanks, David, and the CPM board for the invitation. Also sending my thoughts to Julia and to other colleagues in Ukraine, as Mònica also said. So as Mònica mentioned, the movements we focused on, well, she didn't specifically mention them. But they were Marea Blanca in Spain, which is also known as the White Tide, and more particularly in Madrid, and also Keep Our NHS Public in Greater Manchester. Briefly, to give you a little bit of context, although I'm sure many of you already know about them, Marea Blanca was one of the struggles that were inspired by the 15M in Spain, and they emerged in 2012, 2013, after the regional government in the Community of Madrid announced a plan to radically privatize the healthcare sector. And in that first moment, the workforce of the 6 public hospitals and 27 primary care centers affected by the plan took the streets, and also the healthcare centers themselves, in order to oppose this plan and to make this opposition visible. As other spending cuts and privatization plans were announced in other parts of the country, these mobilizations quickly spread to other hospitals and healthcare centers, and a nationwide network of autonomous local groups and protests was formed. As all sorts of protesters used white coats and clothes to symbolize their support with healthcare workers, they became known as this White Tides, which eventually became a struggle in defense of universal and free public healthcare, and which brought together health workers, but also patients and neighbors all over the country. In the case of Keep Our NHS Public, it was a non-party political campaign that was created originally in 2005 as a number of loosely connected local and regional groups spread across England to resist the process of corporatization and privatization in healthcare that Mònica described. And a new impulse in this campaign was experienced in 2011 after the then coalition government announced the Health and Social Care Bill, which was expected to bring substantial changes in the national health service, and among other things aimed to transform public hospitals into foundation trusts, which were obliged to be financially viable and which could earn up to 49% of their income from private patients. So Keep Our NHS Public in Greater Manchester is one of the local nodes that were created and emerged in this context. So what we were interested in this paper was the different ways in which those two struggles use multi-scalar strategies and tactics to contest these transformations that were happening in healthcare policies and services. So on the one hand, we analyze what we conceptualize as downscaling practices aimed at building and empowering local communities. One of the key strategies was then the downscaling of their practices to individual healthcare centers and sites, and their grounding to local context in order to bring their campaigns closer and to connect needs to the local communities. So this way, the movement incorporated different territorial demands, such as avoiding specific closures of services or stopping the privatization of specific hospitals. This was, in both cases, premeditated and also a very practical strategy that allowed for the articulation of solidarities and alliances across both old and new local initiatives, and also with the local residents that were affected by these changes in public services. So this was done obviously in different ways, but mainly through sit-ins and occupations of health centers in both places. And these were not only aimed at protesting and disrupting the normal activity in these hospitals and services, but also to reappropriate these spaces and to vindicate the power and show the centrality of public healthcare spaces in local communities. So the goal was not only to show this, to visualize this protest, but also to repoliticize and empower these spaces and transform them into what we could call centers of resistance. Each of these decentralized spaces was autonomous and organized through open assemblies where community initiatives to organize local actions were organized. These non-hierarchical and decentralized spaces, we argue, were also very relevant to break what had increasingly become a very corporatist sector with important divisions both between different types of healthcare workers, doctors, nurses, social workers, administrative staff, and others, but also between them and the populations. So in the case of Spain, at least, it was also a way to guarantee that the movement was kept its independence from the main trade unions, because it challenged their capacity to reach an agreement with a particular healthcare sector, with a local group, or with a medical organization. So on the other hand, we also look at this movement's upscaling strategies, which were mainly aimed at bridging space and forging anti-austerity networks of struggles. So in parallel with this local organizing, the movement also organized in regional and national-wide platforms to coordinate protests, but also to build these alliances, these anti-austerity alliances. In this spirit, we see, in the case of Spain, the Marchas de la Dignidad, Marches for Dignity, and in the case of the UK, the People's Assembly Against Austerity, through which they not only protest against the privatization of healthcare, but also coordinated political actions and challenge current models of welfare state dismantling and austerity. Finally, another upscaling practice that we were very interested in is a type of coordinated action that they developed and that we name in the paper the judicialization of resistance, as opposed to a very well-known in political science term, which is the judicialization of politics. We define this judicialization of resistance as a strategic use of the justice system from below to challenge the legality of certain public authority decisions, to struggle against the unlawful use of powers by public bodies, and to protect social and political rights. So this, in the case of Madrid, the regional platform in defense of public healthcare, together with different medical associations, trade unions, and eventually the Socialist Party in the region, they launched a lawsuit against the tendering procedure that awarded the management of public hospitals and health centers to private companies. So through this pressure mechanism and high levels of mobilization, not only in Spain and in Madrid, but also all over Spain, they ended up suspending the process of privatization and forcing the resignation of the regional Minister of Health. In the case of the UK, the justice system was also used during what's known as the Justice for Health dispute. And this was a campaign organized by junior doctors to avoid further precarization of their contracts. In this case, in spite of a very successful fundraising campaign that managed to raise over £300,000, and also the organization of unified actions and strikes and picket lines in multiple hospitals, with which key branches public health. The new type of contract was introduced, but after years and years of pressure, in 2019, certain improvements were announced by the government. So in this case, the judicialization of resistance showed uneven results, but still it proved to have a certain effect and to become a strategy that could at least create a certain legal uncertainty and to slow down or reduce the scope of certain political processes. So this is a very summarized account of the two cases. I don't know if Mònica wants to wrap up and bring this to some conclusions or to current events.
Thanks. No, I think you've done like a really good job. I think one of the things I think that might be worth also considering in the discussion is that last point that Olatz was making of the whole concept of judicialization of resistance, because I think that is something that, you know, I remember when we were kind of thinking about it, it was something that we thought was kind of very important, particularly in you know, the way that the paper was streamlined from the original chapter to an actual paper meant that about half of the chapter from the PhD got dropped because the article is much shorter. But there was also a lot more in the original thesis of not just the upscaling and downscaling of resistance, but also this kind of sideways type of moments in which, if we were to think in terms of institutional political arenas or institutional arenas, it's not just an issue of actually going towards either the executive or the legislature, but also how there can be that kind of use of judicial powers by different groups and movements. And something that certainly is not as common within the European context, but something that, for example, is very common in the United States with the roles of the ACLU and even kind of very judicialized social movements to an extent. So I think that's something to also consider and think about, and to what extent that might be a viable possibility or not, with the caveat that I remember when Olatz and I were discussing that quite a lot, that there was also an element of looking at that not necessarily as an exciting opportunity of using the judicial system, but also as a possibility that the judicialization of resistance might also have a demobilizing effect. And the reason why it might have a demobilizing effect is because the moment that you bring resistance to such a technical level, such as the legal system, then the rest of us are somewhat outflanked because we're no longer needed. We're not lawyers. So what's the point in us? The struggle moves into a space that we might not necessarily have any kind of participation in. And so whilst we thought it was certainly interesting and certainly contributed to the struggle, we also thought that it had some dangers. But I think I'm looking forward to hearing Mary's comments and thoughts and the rest of you.
Great, thank you. So over to you, Mary.
Great, thanks a lot. And yeah, I'd like to first echo Mònica and Olatz's sentiments on the crisis in Ukraine and sending our thoughts to colleagues there. And yeah, thanks very much again for inviting me to comment on the paper. I was saying to Mònica and Olatz before that it's been really helpful in my own research. There's just a couple of ideas the paper raises that I'd like to engage with. And the first is sort of the different ways that scale is played with by the institutional actors and activists, and how that this is expanded on paper and how it contributes to our ideas of scale. And then the second is the relationship between the collective vision of the health service and the ability to jump scale. So on the idea of scale as a relational concept, as we were talking about just before the session, this is something that geographers have expanded on a lot. There's a lot of theory on this area, but I think the paper makes a really important contribution by tracing how it's used differently by activists and by government in two different sides. So to jump for a second to social movement theory, moving scales is a really central concept in social movement studies, and the idea of the political opportunity structure, like Charles Tilly anyway, last name Tilly, first name ambiguous, talks about how, the sort of OG social movement, the labor movement, jump scale as power is reorganized at the state level. And sometimes just kind of simplistic idea when we think about the EU that when power is centralized, it's important for social movements to also reorganize and move to the area that power is moving to, if decision-making power in fact is jumping scales. And at the same time, you have people like Marx and McAdams highlighting that it wasn't as simple as that labor movements did organize peak level trade unions, but partly because they wanted to bring more power to the national level. They wanted to expand the role of the state so that you had national level protections for workers. So it was something that strategically benefited them. And I was thinking about this a lot when I read the paper, because I think you can see in both examples that the social movements involved actually seem to make a conscious decision not to follow the state when it rescales and not to scale jump. In Ireland, we have this expression, like if you say jump, or if I say jump, you say how high, and in this situation, there was a jumping on one side and a refusal to jump on the other. So in the Spanish example, there's this discussion of how there was constraints at the regional level that were imposed by these new levels at the European scale. And there was an attempt to say that hands were tied and that austerity was, this tablet being handed down from the mountain of Europe, and that there was no room or margin or room for maneuver there. But the Marea Blanca really focuses its activism at the regional level. The targets of the protests weren't the Troika or the EU. It was very much personalized to the Prime Minister and the President of the regional community at the time, and also was personalized to the Health Minister. And by refusing to go to the European level, they just don't give that level of power. And it kind of shows that in some ways the European scale rules are this sort of emperor's new clothes that make it seem as if there's no choice when actually there was, because of course, as we saw in that case, it was possible for the activists to reverse the decision. I think that's really important because, for example, in our project, we're looking at new economic governance regime, and one of the hypotheses of the project was that there might be transnational activism provoked by that. And sometimes we might have this idea that if there isn't transnational activism or organization, that's some kind of failure, where actually it shows that activists can very consciously decide to contain a conflict, and actually they can then decide where, or they can, I suppose, reveal where power really lies. So I think that was really important. That story was told really well in the paper. And then in the Manchester example, you were discussing about how the UK attempt to localize healthcare policy, and that actually that was a way of disempowering the campaign by denationalizing the NHS when this was seen, or when it's seen as there's a national vision of the protest, and there's a national vision of the service, and how it's really well regarded by users, and that this has given campaigns power. And I think it's really interesting that you highlight that the UK government was trying to denationalize the NHS, because actually that national vision of the NHS was constructed by activists. So from the 1980s onwards, as a response to the threat of policies being brought in by Thatcher, local groups who had originally mobilized very much in defense of local services and had sort of particularistic demands, very consciously constructed a vision of the NHS as a shared public good. So the UK, by trying to bring things to the local level, is trying to sort of break down that vision and have maybe more competitive local movements arising and trying to bring activism to that level. But again, you saw with the campaigns that while they still gave support to the local level, the framing of the service remained very national. And again, there's a refusal to go to the local level, and also a recognition that this rescaling was only apparent and that decision-making still remained at the national level. And yeah, that was something that, again, was really illuminating, I think, because in Ireland, there's been a lot of, which is where my research is focused, organizing in healthcare is very local. So there's a lot of protests. There's been lots of protests about closures and withdrawal of funding and services, but there's been a real difficulty in constructing national movements. And I think part of that is to do with the absence of like a shared pride in, or a collective vision in, the health service as something good and to be protected. And partly that is just because objectively our health service isn't as good as the service in Spain or the service in the UK, but also it is easier to have these connections between local campaigns and regional or national campaigns when you have something national that sort of acts as like a shared fabric that is coating everyone and that everyone sort of feels connected to. And you can say, when you're protesting about the closure of your hospital, that it's an attack on everyone. So it's easier for local campaigns to feel seen by a campaign at a higher scale because they understand that they're fighting for the same thing. And also local campaigns don't seem as particularistic, whereas in Ireland, the campaigns have tended to be kind of competitive. And also it's difficult to, when people have tried to unite, it's more difficult to have a common vision or common goal, because not many people want to say save the HSE in the way that you would want to save the NHS. And I think in terms, just like responding to what you were saying about the extremely damaged healthcare systems that we're seeing now coming out of the pandemic, this is just a small point, but I think while there's more sort of focus on healthcare now, it's also maybe a more difficult time for healthcare workers because of the exhaustion that they have experienced in the pandemic. And in Spain, for example, there's been a 10-year cycle of protests in Madrid. And I think we have to think about how that actually impacts activists and how that's going to be continued on. That's something that I've been thinking about a lot. Just who do we actually ask to be the protagonist in the post-pandemic movements? And while it's on one hand, it does seem like it should be the workers, also, is it fair to ask the workers? So yeah, those are my thoughts, and thanks very much for asking me to comment.
Great, thank you. That's really opened up a lot of questions as well around this, the general argument around scale and resistance. So that's really good. Thank you, Mary. Do you want to come straight back on any of those points, or should we seek more general comments from the floor?
I just a couple of things really on kind of, but I'm happy to open mostly to the floor. Just a couple of, I think, important issues that I suppose Mary's made me think from her comments. And I think it is true that there's a sense, so mobilizing against, for example, closures, in a way it's easier because all of a sudden, people are thinking, oh my God, I had a primary healthcare center or I had a hospital and now I'm not going to, and the other one is going to be furthest away. But actually a lot of the mobilizations that the paper talks about, and a lot of the key issue here often is not so much the closure, which because in a sense it's easier to mobilize against closures, is the kind of commodification and privatization. And that often can be harder to mobilize against. And I think in the case of Madrid, for example, that was very clear because, most people, most average people don't really care how their healthcare might be managed, as long as when they're ill, they go and someone looks after them and they don't have to pay for it, right? Whether what's happening behind the scenes is managed in one way or another, to them might be largely irrelevant. And so that really kind of becomes harder to mobilize. And I think that's sometimes some of those groups and movements that we've looked at have been very successful at kind of translating what that means for people and what that commodification ends up meaning in reality, in terms of then kind of dropping of service, having a profit motive behind rather than getting people healthy as the motive for healthcare systems. So I think sometimes the challenge is to see how those processes that do not end up in a kind of direct impact on people, or people might not see direct impact, how we can also mobilize against those. Because also those are often more common and more long lasting than the other ones in a sense. And the other one, and I think that's a really important point that Mary made again, it's the idea of activism exhaustion, and particularly, especially if we expect, in healthcare, if we expect the activism to come from the workers after 2 years of pandemic, that's going to be really, really difficult. But we also have to think in general, and in general, there seems to be, after kind of a decade of very high levels of activism post 2008 and now 2 years of pandemic, I think activism exhaustion is a real issue, and amongst workers and amongst activists in general. And so how can we reactivate that at some point? How we can go from that current slump that we're having towards reactivating also, let's remember, social movements are called social movements because they're social, and we've had 2 years where we've not really been very social, and so that also has a lot of issues in terms of reactivating those elements. But I think the two cases here are interesting, particularly because in both cases there was an involvement of workers, service users, and society at large, and so there was an understanding of the public healthcare service, not simply as a kind of labor industrial issue in part of the workers, but as a public good issue, as the commons, as a defense of the commons by anyone involved and society at large. Something but those are kind of important questions, I think.
I just wanted to add a very brief thing, and maybe I am now in a moment of like slightly pessimistic state of mind or something, but also seeing the evolution 10 years later of all this wave of protests, because this is a paper that's been building up for years. After the protest, we were quite hopeful because, as you might know, in Madrid, there was, in 2015, a very progressive local government was elected. And for 4 years, it looked like something was going on and something was gained through all the protests of the 15M, and specifically the healthcare ones, because they were very central in that. But after that, everything was kind of lost in a way, and specifically during the pandemic, with a new wave of a conservative government in Madrid, in the community, a lot of all these emergency decisions that were made of building new centers for attending patients during COVID, buying face masks even in China, everything was done through very opaque processes, and normally through contacts of the actual, like, it's been emerged a few days ago that we're actually like the brother and some contacts of the current president of the Community of Madrid. So we'll see if like all these struggles in the long term pay some, that they are worth it or not. Because sometimes when we are in the moment, it looks like a very effervescent and very active, I don't know, moment of hope. And maybe 10 years later, we have like this going down of the wave, and it's quite worrisome actually.
Thank you. That's great.